Good morning, everyone. Welcome. Good morning. Welcome to the NeuroPace Investor Day. This is our first Investor Day, and we're very excited to have you all with us. A lot of familiar faces in the room. We really appreciate you taking this time to learn more about the NeuroPace story. We have an exciting program for you today. We hope you'll come away today knowing more about the company and being just as excited about our future as we are. So let's take a quick run through of our agenda. In the first part of the day, you'll hear background about the company, our technology, our results in treating patients with focal epilepsy. And then you'll hear from a couple special guest speakers, as well as an individual who is living with the RNS system every day. After that, we'll have some Q&A. We'll have our panel come up. Then we'll take a quick break. And after that, in the second part of the day, we'll be more focused on the future. We'll talk about our clinical product and market development efforts. We'll have another special guest speaker. We will give 2025 guidance and then conclude, and lunch will be available outside the room. So let me introduce the folks you'll be hearing from today. We are absolutely honored to have a number of physicians speaking with you today, all of whom are luminaries in the epilepsy field. First, we have Dr. Vikram Rao, epileptologist at UCSF in San Francisco. Vikram has lots of experience treating people with epilepsy. We also have two neurosurgeons who will be with us remotely, Dr. Mark Richardson from Mass General and Harvard, and Dr. Samir Sheth from Baylor College of Medicine. And our very own Mike McKenna will share his journey with epilepsy and treatment with the RNS system. You'll hear from members of NeuroPace management. I think many of you know our CEO, Joel Becker, who joined us. Joel joined us about a year and a half ago with significant executive experience at big name companies that you all know well. I'm Rebecca Kuhn, the company's CFO. You'll hear from Dr. Martha Morell. Marty is also a luminary in the field. In addition to being NeuroPace Chief Medical Officer, she is also a professor and epileptologist seeing patients at Stanford University. We have Dylan St. John, our Chief of Commercial and Development, who is holding down the fort at home back in Mountain View. Katie Keller, our VP of Marketing. Katie is relatively new at NeuroPace. She brings significant experience developing markets in the cardiac field as well as neuromodulation. And we have Brett Wingeier. His last name is a bit difficult to pronounce. I hope I did that okay. Brett was rehired fairly recently, but Brett was actually one of our early employees who was instrumental in developing the RNS system and analyzing our clinical data back in the early days.